Hey, Dr. Fisher here. Today I want to talk to you a little bit about how I implemented Fisher traction in my practice. I've had chiropractors, physical therapists, and even trainers ask me, how can they incorporate Fisher traction into their daily treatment of their patients. And one of the things that I created many, many years ago, I used to have these platforms set up in my office back in the olden days in Santa Ana, like over about 20 years ago, 15 to 20 years ago. I had therapy tables, which most all of us have, and I wanted to get my patients on traction and decompression. And back in those days, I couldn't afford the big expensive traction tables, and they weren't even that prevalent back then. So what I did was I created this, basically it's a 2x4, and I drilled holes in it and I attached it to the drywall with molly-lag bolts behind it. So it's incredibly strong. I mean, I could, if I wanted to, I could probably, put my body weight and hang on it where there's no way this thing's coming off the wall where it could hurt anybody. But I put these eyelets on here where I could change the angle of pull for any of the tractions that I wanted to apply to my patients based upon the level of injury. So what I've done with this one here is I have both of our low back units attached to the same level, and the reason why is that this angle is about equivalent to where a doorknob would be if you're laying on the ground, which gives us about a 35-degree angle, which hits the majority of the low back. Okay, so you can interchange these and move these around, but what we do is once you got it hooked, it's super simple to get patients, and our patients now, they come in and they just set themselves up where they'll just loop the traction around and then they'll lay back and they'll push themselves out on the therapy tables. Okay, safe, easy to use. They get into a routine where they practice using it. And I think this is a great opportunity for young chiropractors or therapists. You maybe have multi-stations and you want to have a lot of your patients experiencing traction and decompression, but maybe you don't have the space or the money to afford the big, huge tables that a lot of clinics have. And you can also interchange. I have the cervical unit here too, and this you can change the angles where you can easily detach them and move them around if you like, and it works out really well. But we have been asked, can we offer these to any of our clients on the wholesale side, which we can. You can actually make these yourselves, but if you needed us to show you how, we can, or if you needed us to supply them for you, we can do that too. Now I'm going to show you one other setup that I have where you can use in different variations in your office depending upon how your office is. Okay, so we'll go over and we'll look at this next one. So I wanted to show you also this variation that I have here and how versatile this is depending upon the construction of your office. I actually attached this directly to the window frame. I drilled it in, and again, this thing is solid as a rock. That metal or aluminum, I was able to drill right into it. And again, I have the eyelets, and we can vary the height. These two are at about a 35-degree angle, which is about 36 inches above the table, which is about the average height of a doorknob at home. And we're able to have multiple stations going on. We've got our shoulder wedges. Patients know how to come in and set themselves up. You could easily have this set up in your office. if you had a gym, you could set this up on the wall, have patients lay on the ground, or your customers and clients lay on the ground. So it's pretty easy way to set this up. Multiple stations, really inexpensive, so it's not cost prohibited. Definitely way cheaper than having one of the big, huge tables, and it doesn't take up the space, and you can still utilize the therapy tables for anything else that you wanted. Okay, so just wanted to show you that.